Welcome back to Fox 12 Now. As always, thanks for joining us. We're live streaming here out of the Fox 12 Oregon newsroom. We start at 1 o'clock every day. We go throughout the afternoon, and we cover a wide range of topics. If breaking news happens, we'll be here for you with that. I'm Greg Nibbler, and for this segment, we're actually going to be talking about vaccines and the importance of those and some trends that are being noticed with that. We are joined now by Dr. Chio, who's going to be discussing this with us. And Doctor, thank you, very much for being here, for being a part of the show, from the Oregon Health Authority, and just it's good, I think, to get an idea of the scope and a better understanding of vaccine rates in the state. And to start off, thanks for being here. Would you mind telling us just a little bit about yourself and then what some of these trends are that you're noticing?
Yeah, sure. And thank you so much for having me. It's such a privilege to be here and talk about this topic that we care a lot about here in public health. My name is Howard. I am a preventive medicine physician, and I'm the medical director for communicable diseases and immunizations here at Oregon Health Authority.
And when it comes to, immunizations and vaccines and all of that side of things, what are the trends that you're seeing?
Yeah. So one of the great things that I love about Oregon is that the vast majority of families are choosing vaccination for their kids. So it's really important to keep in your mind that around 90% of kindergartners through 12th graders statewide are up to date on their vaccines. And that's amazing. What worries me and what should worry everyone are two main things. The first is that there is a lot of variation in between schools. So some individual schools will have much lower vaccination rates. And a great example of this is the measles vaccine. So 1 out of 3 schools in Oregon are at risk for a measles outbreak because their vaccination rate is below that 93% threshold. We sometimes call it herd immunity, but that's the threshold of vaccinations that you need in order to stop a measles outbreak from spreading broadly in the school. So there's a lot of variation in between individual schools in terms of how vaccinated their student population is. The other thing that really worries me is that the overall trends are going downwards. So this year, the number of students with vaccination exemptions for non-medical reasons, that rate is at 11%. Also this year, the number of kindergartners who aren't up to date on their vaccines, that's at 14%. And both of those sound small, but they're both at historic highs. And I think the overall direction really worries me. So what I really want to do is make sure that we are empowering parents and empowering families to make informed decisions, and really want their parents to revisit and reconsider their vaccine decisions in context of this changed situation here in Oregon. And I'm telling my friends this, I'm telling my parents, like anyone who's a parent this, we have a great dashboard available online where you can actually look up the specific vaccination rate for your school, because knowing the vaccination rates just in your neighborhood is so important.
So actually, providing that data and letting people have access to that data just right there on the website.
Exactly.
Talking about vaccinations and at a historic, as you said, a historic low, what are some of the reasons that you're seeing or hearing as far as why people aren't getting the vaccines, and maybe some of the reasons that if you've heard some common reasons, maybe you could provide your side of that as far as why they should?
I think just probably a lot of different factors that are going on here. We actually don't have great systems for really measuring how people are thinking and their intent and their behavior. So one of the things I try to remind everyone is that we're actually all on the same team here. Everyone wants what is best for their families and their kids, and they might be hearing different things from other people. We also know that that access can often be a challenge across the state. We also know that parents are, in general, incredibly busy and may not always have the time to go see a provider. So there's a lot of different factors here. I think what's really important for parents to remember is that they have the power to make the decisions for their families. And I encourage people to not just look at the vaccination rates for their schools, but to then have that conversation with their pediatrician or a nurse or a healthcare provider about the decisions that they're making. One of the things that I think is really telling is that the vast majority of pediatricians choose to vaccinate their own kids. So pediatricians and healthcare personnel are really some of the best people to talk to, because they're not just thinking in the space professionally, but also making decisions for their families and for themselves. The last thing I try to encourage parents to do is to really talk to older people. Grandparents, teachers, like anyone who might have some memories of living in the United States a few decades past. And anyone who remembers that time period in the US when a lot of these diseases were really much more commonplace. And one of the stories that I've loved, I recently connected with one of my sixth grade social studies teachers. And, I heard stories about how there were celebrations in the streets, spontaneous celebrations when the polio vaccine was first announced. And that's because during that time period, people really experienced how awful these diseases were on a day-to-day basis. And our vaccines have really worked so well that I worry that a lot of that history is forgotten. And learning from that past, I think, is really important and relevant today when we are seeing a resurgence of these historic diseases.
When we look at these low vaccination rates, what are some of the potential ramifications of that as a society, and maybe for some of these diseases or things to even make a comeback?
I think a lot about that because school is so important, right? Like kids really need to be in school and learning. And the reality is that kids don't learn well when they are sick. That's just the reality. And when you have a lot of kids together in a school with a low vaccination rate, it can really affect learning for a lot of students all at once. And that's worrisome. The other thing to keep in mind is that the vaccines exist because they protect against disease that can be really awful. So anyone who has heard the sound of a baby with whooping cough, it's heartbreaking. It's miserable for everyone who hears it, and that's a cough that can last 100 days. And especially for babies, can be fatal. Same thing with measles. Measles is much more than just a rash and a fever. I actually took care of a patient with measles in the hospital a few years back, and it always sticks out of my memory because people don't recognize how severe it can be, especially with adults who get measles. Often they're surprised at all of the lung complications that can happen. Something else that I don't think we talk enough about is that measles can cause this thing called immune amnesia, where your body forgets how to fight diseases it used to know how to fight in the past. So you're at increased risk for other infectious diseases, and that effect can actually last up to 3 years. And that's on top of the risks of pneumonia, brain inflammation, brain damage, like all the kind of rare but true severe possibilities when you do get something like measles. So when you have a lot of kids who are together who are unvaccinated in a school with a low vaccination rate, the risk of an outbreak is just so much greater, and that leads, at best, to to students missing days in school, and at worst, some really severe health outcomes. And kids really need to have that freedom of being able to learn in school. And one of the best ways of ensuring that the kids have that freedom is really through vaccines.
And these are things that have been, like the measles vaccine. I mean, this is decades old. This has been tested over and over and over.
And I appreciate that reminder. That's something else I tell parents about, is that the measles vaccine was first developed in the 50s, right? And then revamped again in the 60s and 70s, but every time there were improvements made along the way. And another core difference about vaccines is that we have really rigorous safety monitoring once the product reaches market, right? So it's not just about the initial studies, but about the decades of data that we have as vaccines are being used. So the measles vaccine is a great example of a vaccine that's incredibly safe because we have this wealth of experience and data to really support their safety.
Anything else that you think is important, Doctor, that people should know?
Yeah, I really just want to encourage, like, not just parents, but also students too, to look up their school and their neighborhood vaccination rates. Our situation truly has changed, and it's a remarkable return of diseases from the past, right? And pertussis is a great example of this, where last year our pertussis cases broke a record that was last set in the 1950s. Measles was declared eliminated in 2000. So really the normal was 0 cases for decades. And this year we have almost 2,000 cases nationally. So parents and families really should reconsider their vaccine decisions and talk with your pediatricians and providers to make sure that they're making informed decisions. And one great way of starting that is really looking at your local vaccination rate for your school and for your neighborhood.
And when it comes to those, you mentioned that people can see those online. Where is it that they can go to access those?
We're happy to send you a link that you can post on your webpage as well. But if you actually just Google Oregon School Immunization Dashboard, it should come right up.
Perfect. Well, Doctor, thank you very much for joining us here too, and sharing this information, getting this out there, letting people know about what's going on, and just being aware that vaccination rates are at such an all-time low. I think is important information for everybody to have. and to go out there and get these vaccinations that can help save lives at the extreme case, or even just keep kids in school, as you mentioned.
Yeah.
At the very best case. Well, Doctor, thank you so much for joining us here on Fox 12 Now.
Thank you so much for having me.
And for everybody watching, we appreciate it. We're going to take a quick break. We'll come back and we'll continue on here all the way until 4 p.m. If there's breaking news, we'll have that for you as well. At 3:30 p.m., we are expecting a news conference from officials in Longview about the situation going on in there. So we'll be right here with that, but we've got plenty more before then as well. So stick right there. We'll be back in just a couple of minutes with more Fox 12 Now.